I'm Dr. Mark Sue, and welcome to the Functional Medicine Reality Podcast. Join me and our community weekly as we bring you unfiltered health from inflammation to longevity. Real stories, real people, real solutions. Experience real-life health changes from both patients and practitioners, and learn how to turn cutting-edge information into real results in your own life so you can feel better, live longer, live healthier, and be confident and clear in your healthcare choices. Let's get real and get results. All right. Hi, everyone. Welcome again to the Functional Medicine Reality Podcast. I'm your host, Dr. Mark Sue. I'm here with a patient guest. Her name is Mihaela. We're going to introduce everyone to her in just a second. So just as a reminder, this podcast is about helping the public, patients, not only become more aware and familiar with functional medicine and the tools around it, but to also talk about not just the good, but also sometimes the bad, sometimes the ugly of functional medicine. And ultimately, we're trying to be truth tellers and help people create more clarity so that they can make better decisions around all the stuff that's all things functional medicine related, right? And a lot of that has to do with how to make better choices so that we're reducing our cost in time, money, and effort with the plethora of options and the stuff we hear about with all the noise from various sources in our self-care and even our practitioner-patient working relationships to get either healthier or to live healthier in a wellness pursuit. So with that being said, Mihaela, thanks for joining us today. If I can just briefly introduce you just on a high level, and then we can kind of jump right into things. I think today's conversation is going to be very commonly experienced by a lot of people. It's a really broadly applicable topic. I have conversations around this with people all the time. But just to kind of put in context, you and I knew of each other, I don't think we'd ever talked live time in the past, but we knew of each other through a professional practitioner type email forum, a functional medicine email forum for that matter. And you are a pharmacist by training. You're working in a pharmacy environment, but through a conventional pharmacy. But you have a lot of experience with the healthcare world, no doubt, and not just the conventional side, but you have a lot of interest in the functional medicine side as well. But anything you want to share or kind of introduce about yourself otherwise, or shall we just dig in?
Let's dig in.
Okay, there we go. All right, well then, so why don't we just go ahead and get started and say, why don't you revisit or share with us briefly? I had thrown out to the email list, hey, we're doing this podcasting every 4 weeks. It's a free patient consult, in exchange for a consent that we're kind of sharing this experience for other people's learning opportunities through your case. So what do you have in mind that you want to bring to the table and talk about?
Well, thank you for having me, first of all.
Yeah.
Second of all, I've had pretty much almost like a lifelong problem with weight. And every time I see a doctor, they tell me lose weight. And I've tried everything. I've tried everything from running marathons and at the end of a full marathon, after training for 5 months and running 30 some miles a week, I lost a whole 1 pound, which made me cry like a baby.
Wait, let me just hear that right. After training for the whole marathon and then finishing the marathon, it was only 1 pound difference from before training?
1 pound.
That's incredible. All right.
Yeah. So and even before I decided to run, I actually used to have personal trainers. I would go to the gym 2-3 times a week. So I was training quite intensely, and people would be like, you need to train, you need to work out, like as if you're fat consequently you must not be working out.
Yeah.
And I was like, well, but I am working out. So then one day I was like, and I remember it was like January 1st, January 2nd, when we all take all these big decisions. And I was like, darn it, I'm going to train for a marathon. And when I started running, training for the marathon, I could not run from here to the end of the street. And, and then by the end of 5 months, I actually completed the San Diego Rock and Roll Marathon. And as I said, I got on the scale after 5 months, and I was like 1 pound lighter, and all I wanted to do was just cry. So I knew at that time
I want to just validate you I just want to validate you on that experience because first of all, I can't run just to run, so I can't
Mhm.
even imagine doing a 5 miler just to do it, much less a freaking marathon. And if I were in your shoe, I'd be completely defeated and defeated and deflated as well. I mean, I think I would cry.
Yeah.
That that's really disheartening.
Yeah. Then after I had my second baby, I had the, you know, the regular women checkup, and I had a mammogram, and they're like, "Oh, you need to come back. We think it's possible cancer." I'm like, great. So
Mm,
then they did a biopsy, and in the meanwhile, before they even had the results, they sent me to visit the surgeon. And the surgeon sat there and she was like lecturing me that, don't you know, fat women are the biggest risk of getting cancer? And I'm like, wonderful. Tell me how to lose
mm,
this weight. I'll do
yeah.
anything. Obviously, I ran a marathon. I'll do anything. Literally, I'll do anything. And so it turned out it wasn't cancer. It was just a lymph node that
Thank goodness. Thank goodness.
they thought is something. So 14 years later now, I'm fine. I'm good, but I still am struggling with weight. And then about 10 years ago or so, I um I was actually introduced to functional medicine world, and they um my doctor was like, "Well, just try to eliminate gluten." And that was for different reasons. It had nothing to do with
Mm,
the weight.
okay.
And at that time, I actually really tested myself for food sensitivities, and I followed that, and I did lose 32 pounds without
What?
any other.
You
But
lost 32
then
pounds going off gluten?
gluten and other, like, I cut out gluten, dairy,
Okay.
some other little things. That I was allergic to broccoli and asparagus.
Okay. So yeah,
Like,
you
okay.
basically followed a food you
Yeah,
took action in response to food
yeah,
allergy testing.
yeah,
Again, a functional food allergy testing, which is
yeah,
IgG based, not conventional.
correct.
And then you lost 32 pounds.
Yes. And
Okay, keep going.
but then about 3, 4 years into it, I started gaining weight, and didn't matter what I did. And I retested
Hmm.
the food sensitivities, which of course they changed because that's the name of the game. And I started like following that, and being very mindful about what I was eating.
I'm
And
sorry, just
I
for
was,
clarity, when you regained weight, were you still following that sort of food elimination or not so much?
yeah, yeah,
You
no,
were.
I was,
You were still eating the same way as when you lost
yeah,
32 pounds, but then you started
yeah,
gaining weight.
yes,
And then you did a repeat food allergy test.
yes,
Do you recall if it was the same lab?
yeah, it was the same lab.
Same lab, okay.
Yeah,
And then you come up with different results.
different results, different foods.
Okay.
Um, and as sad as I was to eliminate garlic, I think that's the hardest allergy to have, to not be able to have garlic.
Wow.
Because with that, you're done with any other food from outside world. Unless you cook it yourself, there's nothing there. Everything has garlic. And
Okay.
not to mention, I think it's healthy
Yeah.
and it's tasty. So
Yeah, yeah.
I was quite sad. But
And
in
then
any case,
what came of this, attempt
nothing.
to follow
No,
this?
nothing. I just kept
Nothing.
gaining weight. And so I ended up, by now, I'm back to probably like 20 pounds
Okay.
from the
So
time when I
you've, like,
lost.
regained 20 of the 32 pounds or so
Mhm.
in the last, you're saying as of, like, 4 years ago, I think you said, or something like that?
This was probably about 7 years ago, 6, 7 years
Oh,
ago, and then constantly just keeps going up. And then I went through a phase where, so about 2 years ago, maybe actually by now it's almost 3 years. It was 3 years. It was because it was a March, and um, I remember I just went to play some pickleball. I mean, how much activities in pickleball.
yeah,
And I played, I used to play tennis, and my husband is like, well, why don't we go? Because they have a couples tournament. Let's go do pickleball. I'm like, all right,
yeah.
let's go do pickleball. And it was very weird because we kept not losing. And my legs started hurting so badly. And yeah, true, we play for 2 hours, but how, again, it's not a marathon. It's not even tennis. It's pickleball. So, um,
But it
and
was weird to you that your legs were sore.
I was so sore that at some point, like my brain would be like, the ball is there, and my body could not even bend to do
Huh.
that. And so, like, we literally um, got out of the tournament because I could not function anymore.
Oh, wow.
And that
You had to
pain,
sort of like disqualify yourself? Withdraw?
uh-huh,
Oh,
yeah.
that's sad.
And we And that pain didn't go away for like 3 months. I mean, it was the kind
What?
of pain that I recall having at the end of a full marathon. That's
What?
how painful it was, and I couldn't even sit down on a couch. I would just have to kind of throw myself on the couch,
And just
and,
for curiosity, were you already physically active on some level before this pickleball tournament?
I would do walks and, no, I wasn't that intensely working out, no.
Okay. Yeah,
Yeah, I
it
took
certainly
a
it was
break.
nothing like training for the marathon, but also not more aggressive intensely exercising, but you weren't, completely sedentary either.
Correct, yeah.
Okay. Sure.
And so that happened, then I don't know, maybe 6, 7 months later, we went. Oh, it improved, but I was constantly in pain to a moderate or maybe even mild amount of pain. But
Okay.
like the moment I would just do a walk, like if I would just walk from here to the clubhouse, which is less than a mile, I would just feel like I ran a marathon, and I recover for like 2 weeks. So it was very abnormal. And then by July, I remember we went to California to visit family, and the kids were playing in the waves, and I was just like standing where the waves are breaking, just chatting with my friends. And I remember, so we were there probably a couple of hours. So yeah, you do use the muscles to kind of anchor yourself in the sand, but give me a break. I mean, what kind of
Yeah.
workout is that?
You're
By
saying
the
your legs felt sore from standing in the waves
Yeah,
of the
and
ocean?
and it wasn't that they were sore. I was in so much pain that I could barely make it to the car.
Oh,
And
wow.
then the next day, my brother saw me, and my brother's a doctor. And when he saw me, he's like, "Why are you walking like that?" I'm like, "I don't know." He I got him thinking. He's like, "I don't know what's wrong with you." I'm like, "I know. I That's how I feel. This is not normal." I
Okay.
mean, so between this two, and now I feel better. I and so that
Better.
pain is gone. I now can go. I do hikes. I do walks. I'm much better.
Huh.
But
You
the
have more
weight,
tolerance now? You can do more without
I have
having those
more tolerance.
the
Hmm.
muscle fatigue kind of thing going
Yeah,
on? Huh.
yeah. So like for example, in
And you don't know why?
no, and I mean I've maybe I know why. I did for like in the spring. I tried some peptides. I did BPC. Is
Yeah, I
that
saw
the
that in your intake form, yeah.
Yeah, and then, so that kind of really improved a lot my
Okay.
condition, and then, in the summer,
By the way,
we
just
were
for everyone's
hiking.
clarity, we're talking about BPC 157. Most anyone who's dug into
Yeah,
peptides knows what that is, but just to
yeah,
clarify, yeah.
yeah. So then we went hiking, in Mount Rainier, so that's not an easy mountain. I
Mm,
did not do the go to the top and back, no. So it's not the kind of hiking, but still, for considering my couple of years
yeah.
of history, I was, like,
Yeah, where
super
you can't walk to the
excited.
clubhouse 1 mile down and back without being
Yeah,
tired. Yeah,
yeah.
that's big difference.
So I think it's a big, I still think I was much more sore compared to my husband or my
Okay.
boys, of course, but they're like, 14, so they should
Sure.
not be sore from that,
Sure.
right?
Sure, sure.
So, um, but, so, but it's the weight that is just like, it doesn't matter
Right.
what I do. My husband, every time I try to do something, he's like, "Okay, let me do it with you." And he loses like 30 pounds and I gain 5. And I'm like, I mean, I know it's easier
I won't
for
ask you how frustrated you get about that because
I know.
that might go down I might be gaslighting you.
I told him, I'm like, "You're not allowed to join any of my
Yeah.
efforts
Right, right.
because everything you lose, I find, so please."
That's
But
unfortunately such a common story between the men and the women. I don't, I'm speaking on the guy's side, but I'm saying it is unfair. It
yeah,
happens a lot for
yeah,
reasons we won't get into right now, but yeah, it happens a lot, unfortunately.
yeah.
Okay. Do you have more or should we kind of jump in a little bit?
No, go ahead. Yeah, I think that's kind of, I painted my sorry picture, but yeah, that's been my my struggle for years.
Yeah, first of all, thank you for being willing to share this on a podcast. Again, our goal is to not just help more people be aware of the how we might approach things through functional medicine. Not that it's cookie cutter, not that the next 10 of my colleagues or our colleagues are going to do things the same way, right? But just to
Mhm.
give a real life example, right? Because you and I both know we could be referred by our closest friend to an awesome practitioner, but when we go there, like it's not so awesome, right? We just don't know what's behind the wall, if you will, and everyone's different. A lot of this is to just give people an opportunity to sort of like see behind the curtain, if you will, and then of course on our side with the virtual practice RootSeek, we are trying to demonstrate for people how we think things through. Okay. Again, we're not all the same, but we are very similar and we work together and we think alike and etc. So, thank you for sharing your story. And no doubt you and I both know this is a struggle that a lot of people have experienced or are experiencing real time now in some way or another. Right. So let me just go ahead and jump into because these are run unscripted. You've provided an intake form just like we see, just like how we process new patients through RootSeek or our office, et cetera. And so we haven't had a conversation to date, but without going into more detail about your intake information, it's not a complicated story otherwise with all kinds of other issues that we've talked about in other podcasts with, at least on paper, known, Lyme, mold, long COVID, immunity, et cetera, et cetera. But let me just ask a couple things just to clarify, especially when you talk about those muscle symptoms and experiences you had. Is it fair to assume that I understood from your intake you've not had any known autoimmune diagnoses to date? Is that right?
Correct.
Okay. Do you have any family history of autoimmune conditions?
No, unless we count type 2 diabetes as autoimmune, then yes.
Okay.
Otherwise, no.
Yeah,
None of
I won't call
the
that.
yeah.
Okay. So then how about well, let me just, if it's actually, let me go ahead and ask one more question, then I'll jump in with a couple of thoughts. Again, not to be overly sort of impulsive or rash, but being that we're doing this kind of like in a podcast setting, then we're just going to kind of jump into things a little bit more quickly than we might otherwise in a total real time setting. But so you alluded to on the intake form and right before we jumped on the recording that you were on a low dose semaglutide or Ozempic before, and I think you said you're still on it now. Can you give me a little more detail around your experiences with that?
Yeah, so considering so I actually even gave a talk on Ozempic and Mounjaro and GLP-1s, and so I knew that there is an anti-inflammatory side effect or good effect of them.
Mhm.
And I do have insulin resistance. I've My blood sugar has been in the 90s probably since I was like 20.
Your blood
So
sugar or your
my
insulin?
blood sugar. And my insulin has climbed up to 27 last year.
Okay.
Um, I don't know how it's doing to date, but
Mhm.
so that's partly why I was mentioning in my intake form that I'm trying. I was trying a lot and intensely to avoid sugary foods, like carbs of any kinds, and so I ate more proteins and fats. So trying to help myself, but so um, so
So
when I s-
with the semaglutide specifically, what kind of doses were you on and for how
so
long?
yeah, so at first I did like 10 units, which is so I'm using a compounded form, so 10 units was 0.25 milligrams. So that's actually the entry
Yeah, the
dose.
lowest starting dose of
Correct.
Ozempic, yeah.
Yeah, so I did that for like maybe 6 months or so, and I did not lose any weight, which maybe it's expected because that dose is more like designed to
Maybe.
kind of acclimatize your gut versus, you know, trying to lose weight. So then eventually I was like, okay, fine. Although I've heard a lot of people talk about low dose, how not everybody needs higher dose. So I was like hopeful.
Sure.
Okay, well maybe I'll help myself. So we'll see.
Sure.
And then I increased to 20 units, which is zero 0.5. And
Okay.
then, so for the last couple of months, I'm now doing 0.75. So I'm approaching. But other than the fact that I don't gain weight, I did not lose any weight. And
Okay, so
so if I
you did 6 months of the lowest dose, and then you
Mhm,
did, at least a month or more of the second dose, and
mhm,
then now you're at, not the 3rd dose because by
mm,
standard dosing, it goes up double, but
1.
you are
Mhm,
halfway between the 2nd and 3rd
yeah,
dose, and that's been for 2 months, and you've not
yeah,
lost any weight on those doses.
no.
Okay.
I do feel that, like, the pain is much milder, so it could be the peptides,
Sure.
uh, or it could be this peptide, 'cause, this one is also
Also
peptide, right?
peptide,
The
yeah.
GLP-1. So
So
or it's a combination of both.
yeah,
So I do feel much better,
yeah.
um, with the muscle pain, but
So can I then also back up and ask you, when you had the muscle pains with your legs you talked about,
Mhm.
was it just your legs, or did you ever have experience with muscle fatigue or pains with your upper body in any way?
Just my legs, and it's probably my thighs,
Yeah.
and to the knees, not even like the upper leg. Like,
Okay.
it's kind of like it stops. It does go up the leg a little bit, but
Yeah.
most of my pain is around the knee and the thighs.
Okay.
I
And can I
mean a
ask you,
calf, not thigh.
did you
Sorry.
ever, inquire about that with any practitioners, primary care, orthopedics at all?
I did discuss that with my primary.
Did you end up doing any kinda testing around your low back to be sure it wasn't
Um,
a kind of like an atypical sciatica kind of phenomenon?
It felt so. For example, this past year, my insurance was quite good to me, and so they paid. So I've done physical therapy with chiropractic for a full year, and they paid for it, and they did trigger point
Oh.
injections. So
But
so I've
no one
done
really had
that.
concerns about it coming from your back as a nerve issue, it sounds like.
Yeah, no,
No one had concerns about that.
no,
Okay. And quite honestly, the fact that, you've I don't know, I mean, it's not impossible, but since you've gotten better, then there's less reason to go looking, so that's fine, but okay.
yeah,
One last question. So you did say that in your intake form that you've had, Lyme disease at some point in the past. Can you, like, really snapshot describe, was it a short-term thing? Was it a longer time journey or whatnot? Or and specifically, did you have aches and pains with that experience?
yeah. So I used Cyrex Labs, if you're familiar with
Yeah,
them.
sure,
So
sure.
there it showed that I was positive for antibodies. I've
Okay,
never
so
had a
go ahead.
tick. I've never so and then a few years later I was muscle tested, and during the muscle testing they told me the same thing, that that Lyme disease is coming up.
Okay.
And historically, I would always have all kinds of pains, and the weird thing, and that also lines up with Lyme. It would be I would have a pain here without any reason. It would go away, and then the pain would move elsewhere, and
Okay,
then I would deal with that pain, and then that would go away for no particular reason,
I see.
and then it would move elsewhere. So that was when I realized that that kind of may present is a presentation of Lyme. That's when I did the Cyrex test to just
Yeah, got
see,
it.
like,
Yeah, so you weren't
um
clinically diagnosed with Lyme, you just had markers on lab testing,
Mhm,
and then you also had somebody talk about it with muscle testing
mhm,
that may or may not have been connected with any
correct.
particular symptoms. Alright, so, bear with me, alright?
Mhm,
This is kinda off the cuff thinking here, but, just on this initial information, I had, like, 3 sort of diagnostic thoughts up front, but they're not sort of treatment-directed diagnostic thoughts, they're more just, um validating, but also your struggle, but also thinking about what might be going on here at the root cause, right? I mean, if we start with the question of, because that's what people talk about that all the time. What's the root cause? What's the root cause? What's the root cause? And so in this case, we're starting out with what's the root cause of such stubborn weight,
mhm,
okay? And then we've got the second topic about your muscle aches and pains, but they're not, I would suggest they might be related, they may not, but let's just look at them kind of separately for, just to keep it kind of clean. So the first thought I have on root cause of weight, you already know this, but I'm just going to state it out there, for anybody else also. God help us, who knows? All right. Like there's no cookie cutter answer. All right. Your story, I think, as I said, I expect a lot of people. I don't think most people are going to say like, yeah, I've run a marathon too and only lost 1 pound. Okay. I don't think that's a common story, but I think there's going to be a lot of people who hear that and say, yeah, I hear that. And that's me because I also did this or this or this or this and didn't lose any weight effectively. Okay. And I think the take home message I have for that is that in America, most all the discussion about weight comes down to eating and exercise, right? And I still believe that for most of America, it's true. Okay. Most of us in America, by our experience, if we were to do it or we've done it before, if we clean up our eating, we exercise more, there's a caloric in, caloric out kind of phenomenon, and we're going to see changes in our weight. But it's not everybody by any means. Okay. The question then for me becomes on a pragmatic level with patients, since we can't predict who it's going to happen for or not happen for, then how far and how long are we going to continue down that journey? Because there's always more you can do, right? I mean, in your case, having run a marathon, I'm not sure how much more you can do, okay? But most people, there's always more. Like everybody will say, I could be eating better. I could be eating better. I could exercise more. I could exercise more. People who are exercising 2 hours a day will still say to me, I could exercise more. But come on, like the margin of change, the margin of benefit is it's lesser and lesser return, right?
Yeah.
So I'm not trying to enable or minimize eating and exercise, but I do have conviction, at this point, 23 years into practice, that there's a lot more people in America who there's issues with weight that are not related to eating and exercise than we speak to, okay, or give it credit for. And your story's got to be one of those cases, okay? I think it's safe to say, without going in through another, more detailed information and journal about your eating habits and all that kind of thing, you've taken great efforts. You freaking ran a marathon, trained and ran a freaking marathon, didn't lose any weight. You've done elimination diets, right? And did have benefit and then didn't. So that's another interesting piece, but you have made meaningful efforts, right? Now, the other part of that, so like 1A, that's really interesting about your story is you have one of those, because this doesn't always happen either, okay? First of all, let me back up a second. When we talk about the eating and exercise thing, I think it's not just mainstream America. I will say, I think that you can tell me if you disagree, that a lot of functional medicine, right, and non-mainstream medicine, I don't care if it's a nutritionist, a health coach, or practitioners, whatever, we also still put a lot of emphasis on eating and exercise because we can always do better. And it's not wrong, but for me, it's going to come down to, well, how far are we going to keep pushing that button and knowing that we can't predict for certainty that it's going to lead to outcome. And if someone like yourself tells your story, okay, even if I am hell-bent on eating and exercise as the main approach, I'm going to argue from a third person perspective that I think the margin of likelihood of benefit, the confidence is low. Do you really want to waste her time and effort? Okay. And I could be wrong, but that's how I would approach that. So it's not just mainstream medicine. I would argue a lot of times in functional medicine, how much are we maybe putting stress on emphasis on the eating and exercise when it doesn't end up happening for the person. Okay. Like we're a little bit over focused on it at times. I'm going to get a lot of flack for people saying, I'm going to get a lot of flack, no doubt, for saying that. Okay. There's going to be people who are like, flame me for that. But your story is an example of what I mean. And the thing is, I'm saying there's no right answer. I don't know how you in the patient perspective or me from a provider POV, I don't know how we make those decisions as to, well, that person has shown that they've made enough effort and the likelihood, the confidence of getting benefit with the eating exercise is not high. Let's turn a different direction. I don't know how we make that decision. Okay. But
Yeah.
your case is a little more straightforward. So we're going to leave that to the side. Okay, the next piece. So topic number 2 here is you have given a great example of what can happen when we actually do that whole food allergy piece. All right. And we say food allergy again, we're not going to go down that rabbit hole, but we're not talking about the food allergy testing by conventional medicine with the skin prick testing or the allergist or the ENT, the immunologist. Those are different kinds of tests, different forms of mechanism. But putting that aside, you did the IgG food allergy testing, 100% sure it's 90, 98, 95+% sure it's IgG testing. And
Yes.
so then when you do the gluten and other foods, right, effectively what you did was you took an anti-inflammatory approach and you freaking lost 32 pounds, right? Now, have I seen people lose weight doing the sort of anti-inflammatory approach, whether it's foods or whether it's Lyme disease or whether it's autoimmunity or whatever? Have I seen that? Yeah, I've seen that. Am I going to predict that for anybody? No. I cannot predict who is going to lose weight from not just the eating exercise, but also similarly, taking an anti-inflammatory approach. I can't predict that up front. Okay. I'm totally open to learning if anybody can actually tell me, like, this is how we can predict choosing which path is going to be your best your highest bang for your buck. Okay.
Mhm.
So, but you proved that, like, you stinking lost 32 pounds. That's on the really high side from my experience on taking that kind of approach, much less just with food allergies. Okay. So kudos. Okay. Kudos. But then you get the you get the wild card, right? You get what do the kids call it? The plot twist. The plot twist, right? You now gain more weight again, and you're, despite doing the same things as before, something's not adding up. And
Yeah.
then you do a repeat test and you follow the same approach of like, okay, now I'm going to change what I'm not eating or restricting to avoid to reduce inflammation, and nothing happens, right? So for me, diagnostically, that means the root cause or root causes of your weight at that time have shifted. Okay. You got a lot of bang for your buck from inflammation. You didn't get bang for your buck from exercising. It's not a calories in, calories out topic. You got benefit from anti-inflammatory diet. Yes, inflammation was your key. Now you've had yet another shift. At least I'd say not just anti-inflammation in general, but inflammation from foods anyway. Okay. So there's some other shift that's happened now. And that's where, okay, we don't know where that is right now. If we just stop there for a second, the way I'm thinking about it right now off the cuff, God help us to figure out what the cause or causes. It's very unlikely it's just one thing. So causes of inflammation are, if assuming your main cause is still inflammation, okay, God help us trying to figure out what it is. And I'll just dare say, and we're not going to go into the rabbit hole here on podcast, and we can talk about it offline, but this is where for me that kinesiology and muscle testing comes really into play. And that's not
Mhm.
like 100% guaranteed either, but yes, that's easily where I incorporate that information, at least, to try to decide, instead of just total guesswork as to which direction we go, right? That, well, how do we narrow our choices? Okay. So, hey, right off the bat from your intake form with inflammation, we could talk about, is it the Lyme disease topics? Now we're pulling in topic number 2 with the muscle pains, right? Because when you
Mhm.
talk about those muscle pains, like, that does not make sense, right?
No.
I can't walk a mile down the street without being out for the next 2 weeks. And then suddenly, without explanation, now I can hike Mount Rainier, right? That doesn't make any sense. There's something else. So that's why I'm thinking, okay, conventional thinking, let's rule out the common things, right? Atypical sciatica, some kind of what we call radiculopathy. It's a nerve issue from the spinal column. Didn't make a lot of sense. You didn't describe nerve symptoms, but nonetheless, I'm thinking about it. But okay, well, don't know, but not obvious. I did start thinking about fibromyalgia, which is why I was asking you, was it only in your legs or did you have pains elsewhere? Like, no, at the time it's just in my legs. But then you back up and say, no, but I've had migrating aches and pains, whether joints, muscle,
Yeah.
not sure, but I've had migrating pains in the past. And that's much more suggestive of a Lyme disease story. Okay.
Mhm.
Um, so there might be some of that underlying there. And then we could sort of translate that topic of Lyme disease, not just to chronic Lyme disease, by the way, clearly here. We're not just talking about that affecting your muscles, but could that be one of your root causes driving inflammation that's affecting your weight, right?
Mhm.
It very well could be, but I'm not going to tell you after all these years that I've had a meaningful number. I don't even know if I've had 5. I don't even know. Okay. People who we treated Lyme disease specifically, and they lost meaningful weight. And when I say meaningful, I'm talking more like 5 or 6 pounds, more than 5 or 6 pounds. And it's not side effects from treatments or whatever, like legitimate concomitant with treating Lyme, they lost weight. It's not a common story for me. Okay. But it's just to say there's a lot of possibilities that there's other inflammatory drivers for you because you've already shown back then that it's not a caloric issue with just exercising. Could it be, on a devil's advocate here, could it be that something's changed and now it is a caloric issue? Maybe, maybe not, but we don't have to entertain that point right now because let's bring in the Ozempic topic. Okay.
Mhm.
So I'm also going to say it is rather unusual. I haven't had anybody go on the GLP-1s for as long as you have at such low doses constantly, persistently. So I can't compare from that. But first of all, I'm just going to say I'm not against GLP-1s, right? A lot of people in functional medicine are. I'm not
Sure.
saying just like it's a blind thing and everybody go hog wild with it and don't care about whatever else and don't care about how you eat or exercise and don't care about protein and muscles. I'm not saying that,
Mhm.
but I'm a fan. There's a lot of benefits, and you know it as much or more than I do, I'm sure. Okay, but putting all that aside, um, it's it's very predictable. People are going to lose weight. I'll bet every single time and win 90+% of the time. People are going to lose weight in a meaningful way. I can only think of one person off the top of my head who, after 6, maybe 8 weeks, they didn't lose more than 3 pounds, and it becomes questionable whether it's, random or related to the Ozempic or the GLP-1 at all. Who knows? But, they didn't go beyond that because they got frustrated with the experience to date. I don't remember how far they went up on the dosing. But I would predict even anybody who stayed on even the lowest dose like you did for 6 months, much less went to the second dose, the second and a half dose now, a total of, it sounds like, 10 plus months, I would still expect that you would have lost some weight, okay? So I'm gonna just bookmark that as that seems meaningfully unusual, okay? So again, something's amiss. Something doesn't quite add up, okay? But I certainly would, fully support you continuing if you're since you're on it, and you don't have any, it doesn't sound like you're having downsides and side effects, I certainly would advocate continuing, to push up the dosing as you are currently doing, okay? If you get to a point where you're on, the highest or next to highest dosing and you still haven't lost weight, then unfortunately you've won that prize too, where like it doesn't add up. Okay? Like you're the only person. Like
Yeah.
that doesn't make sense. Oh, I take that back. I have 2 guys. I'm sorry. Because I'm thinking about people who are just trying to lose weight. I have 2 guys who I see who are diabetics, and after a year and on meaningful doses of the tirzepatide even, they've not lost.
Mm.
And again, I say, this is a zebra situation. This is a very unusual situation because everybody else loses weight. Okay, so there's something else weird. Okay, so I know I'm being wordy here, so let me move on. So there's that Ozempic piece. Then we're talking about second root cause inflammation as a category, and of course the GLP-1 we could put in that scenario, that umbrella, that category, that because it does have anti-inflammatory effects. It's not just a calorie in, calorie out topic. Okay, most of the
Sure.
people I talk to, they assume that they're like, well, of course I'm not hungry as much. I don't eat as much. I've lost weight, but as I've said, I've had people like that person who after 6, 8 weeks only lost 3 pounds, like they said, It feels to me like I'm only eating 30% of what I used to eat. That's how drastic my appetite has curved, and yet I'm not losing weight." That's the opposite reflection of, like, it's not just about calories. Okay,
Yeah.
so in the inflammation scenario, right, we have some options, and we can take it offline, but we have some options on the, digging for root causes of inflammation because you actually have, which is highly unusual for me, you have a track record to prove that you have an inflammatory driver of weight. Okay. So then, third and lastly, for me, I guess I'm thinking about autoimmunity. And I asked you about that. Um, it's a very broad topic. It doesn't mean a whole lot necessarily with weight per se, but I guess it's a kind of variation on a theme from the topic of inflammation because autoimmunity is inflammation, of course. But, I've had a few. Oh, I'm sorry. I had a different third topic. So I'll make that 2B, okay, or 2A or 2B.
Okay.
Autoimmune as another variation of inflammation here, but we don't need to go down that road. It's just to say I have had, finishing that thought, I've had a few patients when we did what I call drainage. A lot of people might call it detox. Some practitioners call it pre-tox. Commonly, when we're talking about treating people with chronic complex conditions like combinations of fibromyalgia, IBS, long COVID, brain fog, chronic fatigue, and the whole thing, right? They're in a real mess. A lot of those folks we will more adamantly recommend a pre-tox slash drainage slash detox before we go treating the problems. Okay.
Mhm.
Again, are you familiar with what I'm talking about?
Like cell core type of,
Cellcore likes
like
to use the word drainage. Yep.
mhm,
So great. Yeah. Yes. Cellcore kind of thinking, or it doesn't have to be cellcore specifically, but the
yeah,
idea is just to kind of clear the field of toxins and inflammation. So that, because when we start to treat problems, a lot of times people get even more inflamed, and so we don't want to add to their
yeah,
symptoms.
yeah.
So, I have had a few people who lost weight doing drainage pre-tox, okay? It was not expected, it wasn't our goal, it just happened, right? And the first couple times I was kind of eyes wide open, right? Because I had no
Mhm.
expectation of it, that wasn't the plan. But, one person in particular I remember was like, "I gave up on losing weight like 10 years ago. I never lose weight. It just nothing. Everything that you said, they could probably say the same, except they may not have run a marathon, okay?
Yeah.
I tried everything, didn't lose weight." And then, after just 1 month of this three-part stack, in this case, we use a lot of Cellcore stuff, so three-part Cellcore stack that we personalized to them, and they said, "My friends said I looked like I lost weight." I was like, "There's no way." I weighed myself just out of for fun. Holy crap, I lost like 8 to 10 pounds, and I had no
Oh,
idea,
wow.
right? So I've seen that before too, and so my point here is that functional practitioners as a community, if you go talking to a number of different practitioners, you're gonna get some people like, yeah, eating exercise, and you're gonna be like, I ran a marathon, and I did that, like, I already did those things." And
And
if
for the
they're
record, I've run 2 marathons and 6 half marathons, so I didn't
holy
stop
crap,
at just that 1 marathon,
holy
so
crap,
yes.
honor to you, I cannot do that, I cannot even think about doing that, I might get nauseated if you make me think about it too long, I cannot run to run. Honor to you,
I
right?
know.
If that practitioner then is like, "Okay, fair enough, I believe you, let's move on," okay? Inflammation, right? They could move on to that topic, they'll say, "Hey, my go-to is, whatever, the food allergies, whatever. Yes, I
Mhm,
did that, and that worked for one time, but not the second time. Okay, I believe you. Let's move on. Next topic, right? People are going to commonly have their familiarities, their biases, and they're going to push that because there's always room for more. The question is, at what point can we stop and say, you know what? I know that's how I usually think. I know that works for most people, but we don't want to waste this person's time. Like they really have given it a good effort. We need to look elsewhere. Like, right, instead
mhm.
of digging deeper on that topic, look wider. Okay, so now we're into the third and last topic that's crossed my mind, and you kind of alluded to this either on the intake or our communications before just now about fight or flight, stress, all that stuff, right? Because you've talked about that a little bit, and you and I are
Yeah,
definitely going to come across other practitioners who that's a big focus for them for weight too. Like we got to get meditation and calming the nervous system, the cortisol topic that a lot of people read about, hear about social media and otherwise, right? And practitioners. It's an understandable topic, of course, it's justified. But again, I don't have any way, and I don't know I don't know how I would believe anybody else to tell me I know exactly how to predict who's going to lose weight on the first pass attempt from cortisol slash fight or flight reduction versus inflammation versus caloric, eating and exercise behaviors, right? Like as three broad topics, and there's plenty of others, but just on those three big ones, I don't know how we can predict that with confidence. Okay. And that's again, muscle testing. That's where I go with that, but we'll put that aside for a second.
okay.
So I'm rambling here. I mean, I'm not rambling. I'm being verbose. I sort of taken the mic here, not intentionally, but just to kind of overview for you a structural way of thinking about where do we go next, right? And if you're staying on those Ozempic, I still would expect, until proven otherwise, that it will help. And of course, you are mindful, as you said, about protein and exercise and not letting the muscles, get too atrophied and degenerated as part of that weight loss. You're being mindful about the usage of such, and I'm fully supportive of the GLP-1s. And so it'd be easy for me to say, hey, you're on a path there with the GLP-1, right? And you're taking care of yourself peripherally to support that. If I were to go to the next step, I'm thinking about, well, in the case that it doesn't go far enough for you, and even if you go to tirzepatide and it still doesn't, which is commonly more effective, as you know, then where do we go next? Yeah, that's how I'm thinking is inflammation is the likely topic. And then it's a matter of deciding which subtopic within the inflammation category as root causes to target as a next step. Any thoughts on that so far?
Yeah, no, I agree. I totally agree. I think the food, sensitivities, in the last year, again, because the insurance paid, I was like, "Okay, fine. let's check the IgE. And um, last maybe a year and a half ago when I did my blood test, I measured the IgE amount. So it wasn't specific, but it was highly elevated.
Oh, the
So it's
total
like, okay,
IgE.
yeah. So I'm
Okay.
like, I'm totally dealing with the allergies, like in the true sense of the word, right? But I knew that I do have environmental allergies, so I wasn't sure, is it food, is it what is it? So I did test for a full year. Then I did injections, the immunosuppression, the immunotherapy injections.
Oh, which one?
Just I don't know.
Okay.
The
But
doctor
we're talking
just
about prescriptions, right?
yeah. So
Yeah.
yes, I actually had to go in office for a whole year. I went and I got the injections, and so after a year, I gave up because I
Yeah.
did not physically
Oh,
feel
I'm
that
sorry.
it
Wait a
did.
second. You're talking about immunotherapy, not you don't mean like Dupixent or Xolair or something like that. You mean
No, no, no.
allergy, like allergy
Allergy,
injections.
correct.
Okay,
Like
okay. Got it.
with the allergens.
Yeah.
So I've done that, and I just got my results back, and my IgE level is now normal.
Hmm.
So
Okay.
maybe it did help. Um, but again, so as you said, like maybe the food is not gonna, it's, we are past that cause. Probably something else is causing the inflammation.
Yeah, it's right. I mean, this is again, I'm just thinking it through the exercise of how do we think through the purpose of what my
Hmm.
verbosity or explanation was to demonstrate for you, and this is what I do with patients, what our team does with patients also is this is how we think this through. In your case, you have such, I didn't know prior to this jumping on with you here, I didn't know it was that extreme, but your story is so much more obvious. So it actually kind of makes the case a little easier, that between the calorie thing, the food inflammation topic, and then it didn't work the second time. So something else has changed. It's a little clearer that
Hmm.
in decision making here than the average person by far. But when we think through the mechanisms, if you will, like categorically, and then break it down into the subtopics, right? Then it gives us more, at least a method and a rationale for what we're doing. Because otherwise, it can feel like we're just shooting in the dark and just kind of guesswork in some way. And that's unfortunately, that's just I don't want to say unfortunately, it's the reality of functional medicine because we have so many more tools in conventional medicine, as you know, right? I like to say conventional medicine, our tools are much more narrow and limited, but they're much more predictable, right? Because there's
Hmm.
so much time and money spent on the research, medicines, et cetera, and putting aside a lot of people are anti-pharma, as you and I both know, which, you're in the pharmacy world and you understand that. But the functional medicine world, we have so many more tools. It's just the breadth and spectrum you know, are it's a plethora of tools, but the predictable outcome is not so great, right? We have some tools that are much more predictable, others not so much, whether diagnostically or treatment, therapy. So we have to just line up our expectations. And I think again, your situation with Wade is it's a equally applicable or fantastic example where do we go next beyond Ozempic if we need to? So I think that the inflammation piece is very. I would have a lot of confidence going down that road. It's a matter of just deciding which sources of inflammation, and you commenting on the IgE antibodies and the conventional food allergy testing. So you crossed that off your list also. Personally, I don't know that I would have thought that to be a driver of weight anyway. I could be wrong, but I don't know if I've ever seen that myself, and I don't know that anybody in conventional medicine talks about that either.
Yeah. I was just thinking like the immune system is made of IgA, IgG, IgM
Sure.
complex. So it's kind of like I was thinking, oh yeah, I looked at three parts of immune system. Let me look at the fourth one.
Yeah.
Um, and so
You've done
it's
your due diligence, right?
yeah,
You know enough
yeah,
to know, hey, we don't understand everything. So if I got benefit from reducing foods from IgG testing that were inflammatory, then there could be something similar in a different realm that's just slightly
yeah,
different. So let me go down the IgE food testing route, right?
yeah,
So kudos to you, right? I mean,
yeah,
you're working at it. You're working it.
Yeah.
Just unfortunate you haven't had more benefit yet.
Exactly. That's the disappointing part. And so I'm sure it has consequences because probably that does make the cortisol go up. So, but then, um, yeah. So
Yeah, and I'll end with if it's okay,
sure.
I'll end this one other thought, and then we can kinda, like we might bring this to a close. Not that we've come to some definitive decision making, okay, because I think this is where it gets a little bit more personalized, and I'll do that with you offline. Okay,
Okay.
so we might say, "Hey, what we've accomplished in this session is it's sort of like the exercise and thought process behind how do we decide when we don't have better tools that on paper can direct us in the right direction more definitively and more confidently. How do we decide which way to go?" Okay, that's kind of like what I'm gathering is this is the primary take-home message. Um, but the other topic I do want to throw out is liver health. All right, and again, this is going to sound at the risk of sounding not very definitive. Okay. A lot of people who struggle with weight have fatty liver. A lot of people perceive it both as patients and practitioners as, "Oh, I have fatty liver because I have kind of like fat tissue, adipose tissue everywhere, including my liver." But we
Yeah.
also know there's plenty of people who are thin looking
Yeah.
outside who are thin. Their BMI is like even under 25, but they've got fatty liver. Right. So the question for me is, well, how many people, and we don't have a way to know, the fatty liver actually is more of the origin and then it's led to dysmetabolism or metabolic imbalances and dysfunction that then manifest also as weight and obesity, right? And that's not a stretch. I mean, we can find all kinds of conventional medicine research around that, okay, but it just doesn't get like talked about in an applicable way in the actual care of a patient in front of us. So I do have some
Mhm.
patients who we have or are taking a different route. This could be like a fourth category of liver health. More commonly for me, that's in the realm of addressing sugar and sugar issues, glucose, prediabetes, diabetes, and the cholesterol topics as a lead target more so than weight itself. Okay, and for me, I'm kind of currently exploring a different form of glutathione to see it to be determined. Okay, but I'm exploring different glutathiones, and then there's a lot of different ways we could talk about liver health, no doubt. Okay, a lot of different ways, and a lot of that kind of crosses over with that whole pre-tox drainage detox approach. But again, our blood tests that we have available to us are not sensitive enough to assess more cellular level liver health matters. I can say that with confidence at this point after a lot of years. So that might be something we kind of bring into the mix for you directly, but broadly applicable to some people. So, with all that being said, I don't want to leave it as too many loose ends here today, but is some of this helpful to you in terms of just directions for next steps
Yeah.
or
Yeah, for sure.
consideration for at least some people? Some people just want to feel more grounded as to like I need to have something to hang my hat on as why did this happen? Why what can I do to move forward or just I just need some semblance of something makes sense at least in my life because so much of life is a little out of our control and then we just need to have a sense of like something at least makes sense whether it's totally true or not or if it's the reality we don't know but at least it makes sense so
Yeah. Yeah, I know for sure. And the liver, it's definitely something that I looked at, and so I've tried to help it along the years. Um, Historically, I also had a problem where my T3 level was always low. My T4, TSH were normal, but T3 was always
weird.
low. And over the years, I remember I was in my 20s. I would go to the doctor and I would describe my symptoms. I was the poster child of hypothyroidism on paper.
Oh.
And it was just like I would just think of food and gain 5 pounds,
Mm.
and I would have all the symptoms that are associated with hypothyroidism. So, and the doctors would be like, "Oh, let me check your thyroid," and then they would check TSH and T4, and they would be like, "You are completely normal. There's nothing wrong with your thyroid." Now I agree with that, but my T3 was always low, so that's why I had my symptoms. Which we know that the liver is what does the basically turns T4 into T3, which is the active
In part
hormone.
yeah
So that's
Or
why I felt the way I did. So it was really liver disease. It was a thyroid disease, but it
Mm.
manifested as a thyroid issue. And so I have been babysitting my liver for many years now, but if somehow I'm not really probably getting to what's really bothering it. Again, it's probably that the same unknown that's causing everything else. That so I don't know.
Yeah, so I think that's where, if it's okay with you, I'll take this. Well, we can stop this here. I'll
Hmm.
kind of
Yeah,
help you out offline on the next step to be more specific and concrete to you.
sure.
But that part is can open itself up to way too many questions on a sort of podcast recording because it's a whole nother animal. So we'll, if that's
Okay.
okay, we'll defer that next step. But
Yeah.
look, again, I really appreciate you just sharing your story and giving us the opportunity, collectively, you and I, in on
Hmm.
behalf of the functional medicine world and arena, and the practitioner community and the health enthusiasts, et cetera. The chance to just think this through and talk it out loud. And because I know a lot of people are going to relate with this. It's just the decision making is very individual, person to person. So that part
Hmm.
we'll kind of save for off camera if that's okay.
Yeah. Of course.
Okay.
Sounds good.
So thanks. Yeah. So I guess to close this down. So again, yeah, for those who are not familiar with functional medicine, yeah, we encourage it, right? Just it's just about expectations, and if you to explore that road for whatever your condition may be, whether it's weight related or if it's fibromyalgia or chronic Lyme or a number of other possibilities. If you haven't worked with somebody and you could use some help, you can certainly reach us at rootseekhealth.com. If you are working with somebody, but it just has kind of stalled, you're not finding further progress and you are looking for any kind of second opinion, we're more than happy to provide that also. Would be privileged to work with you. And this is what it looks like. This is what functional medicine's about, and just being real about the parts that are predictable, the parts that are less predictable, but exercising the thought process and understanding physiology and health enough to be able to help patients in the point of care right in front of us to make rational decisions in the midst of a lot of the noise and such that aren't well explained or just sometimes even conflicting or contradicting online, much less between practitioners. So thanks for joining us, and thanks again, Mihaela, for your willingness to share.
Glad to help and basically show the world that there's more to medicine than just the lab tests and um, the root cause. I think ultimately it boils down to that. And sometimes we cannot find it, but it's still better than to not even know about it, that there is something out there. So,
Amen. I didn't want to complicate it. I was thinking the same thing. I didn't want to say it to complicate things, but you said it, so amen. It's not always identifiable, but
mhm.
it more we can often find benefit to some degree one way or the other. And so it's just a decision of do we want to explore? Are we going to kind of like be victim or just be passive and just accept what we don't necessarily have to accept?
Yeah, yeah, exactly.
I
Hmm.
love it. I appreciate you. And so thanks for your continued work in your, in your own professional world and in your own community and life. So thank you.
So fresh, just the way you like it.